Value-based healthcare has three essential parts. The first part is that it's radically focusing on patient value. Patient value is the medical value for patients related to the cost. The second essential part is that the value is created by doctors and their teams and patients and their families. The third essential part is how do you organize this in a meaningful way. That means that everybody needs to focus on outcomes, on costs, and on collaboration between teams. The concept of value-based healthcare has been developed at Harvard. The leadership came from Professor Porter and Professor Tijzenberg mainly. We are currently heavily involved in the implementation of that concept, mainly in the Netherlands and Europe, but it's getting root around the world. Value-based healthcare is a very inspiring concept. It's the only concept that I know that's really focusing on patient value, that's really taking into account the costs that are involved with that. And it's very, very important for everybody in the world to have a healthcare system that's affordable and that's delivering lots of value for patients and is creating a lot of focus and fun for the doctors, for the nurses, for everybody involved. We specifically want to award projects with the Value-Based Healthcare Prize because in projects the real value is created for patients. That is where doctors and nurses and their teams collaborate. That is where patients and patient families are working. That is where the value is created. That is where the cost containment must come from. And we specifically want to encourage collaboration among all these parties involved. And collaboration that is so key in today's healthcare. As chairman of the jury of the prize, my primary role is to make sure that the 6 distinguished professors that we have in our jury will come up with the best winner. I'm a non-voting chairman because I'm Dutch and I don't want to vote on Dutch projects. The Value-Based Healthcare Prize is awarded under the auspices of the Value-Based Healthcare Center Europe. The Value-Based Healthcare Center Europe is a platform, and in that platform people exchange their experiences on the implementation of value-based healthcare. That has happened for a couple of years now, and that is why we are able at this point to award a prize. The Value-Based Healthcare Prize is supported by the Harvard team of Professor Porter and Professor Tijzenberg. It's supported by 30 applicants this year. We're very proud of that. It's supported by the Value-Based Healthcare Center Europe, the Decision Group and the Decision Institute. I like to thank also all our academic and medical support and partners, and especially our media partners. Special word of thanks for ICHOM. We have been collaborating with ICHOM for the last couple of years. We provide them with a lot of insights on our implementation experiences, and they provide us with a lot of insight on measures and measurements from around the world. Thank you, and I hope to see you soon at one of our events.